So now, if you want a sort of a preview of what I'm going to be up to and what I'm going to be emphasizing as president, you just had it. The first thing is Fed's out of health care. Is that quixotic? Is that... Is that tilting at windmills? I don't know, and I don't care. So there you go from your president, ignorance and apathy right off the bat. The point is, sometimes the only moral answer is no. That's the only answer you get. Winston Churchill was fond of putting words in the mouth of ancient figures and defying you to say if they did or not. He once said that Alexander the Great said that the Asian people were enslaved because they never learned to pronounce the word no. Now, I'll leave it up to you to decide for yourself if Alexander the Great really said that, or if in fact just making your way to the Indus River constitutes enslaving the ancient people. The point is not historical, it's political. Sometimes the only moral answer is no. Maybe you don't think you're going to win, maybe it's going to cost you. Still, the only moral thing to do is to say no. Feds in healthcare? No. Second thing. Primary care. Primary care is suffering. It's getting harder for people to do what they're doing right now. If you grew up when I did, primary care was the practice of medicine. Marcus Welby was a family doctor, and you cannot safely take care of people with a bunch of specialists like me cobbling together all their pieces of the patient and think that's comprehensive care. Primary care failing for doctors to be able to practice that, at least in this state on my watch, is not going to go unanswered. Not going to happen. No. Yeah. Third thing, county medical societies. Maybe California can get by without their county medical society system, but we cannot do it. That's where we get legislation started when it needs to get going. That's where we stop bad legislation. We would not have passed Prop 12 without doing that at the county level. If we'd have tried to do that in Austin, wouldn't have worked. We probably got it done. And at the very least, the things we're doing now, if we only do it in Austin, much more expensive. We got to have our county systems up and going. That's where your leadership comes from. That's where everybody at this front table came from. That's where we build that up. Our county system has got to keep going. Now, understand, I'm talking about ailing county medical societies. There are some county medical societies in this state that are doing great. They are the envy of most state medical societies. I'm not talking about that. But we have some that need some help going up, and that's going to be part of my focus. And if you've got a place that needs a visit, call me. I will come. And the last thing I've got for you, unless you've been through the Darwinian process of getting through pre-med, getting into medical school, surviving that, going on matching, going to your residency program, learning your trade, then getting out and proving that you're competent through board certification or other equivalent means, you don't get to call yourself a physician. That we just... We can't have that, and my request, maybe challenge to Dawn Buckingham and Darren Whitehurst for 2015, we've already got the bill passed that says if you're a medical student, resident, fellow, fully fact, you got to be identified as what you got. Is it not logical that we would have something that say Doctor of Chiropractic, Doctor of Podiatry, PhD of Nursing, so people know who's dealing and what their credentials are? Isn't that just transparency? And haven't we decided a long time ago that's very simple, basic bioethics? And if you think we've already won because the session's almost over, most of you already know this, but I'll tell you, the 2015 legislative session for us has already started. We got to get the work done now to make sure we get our goals accomplished, and most of you are already working very hard.